Good afternoon, Sarah. My name is Jill. I'm a master's student here at Cedar Crest. Thanks for agreeing to participate today. I'm going to start by verifying some biographical data. Were you born July 15th, 1990?
Yes.
Okay. And your insurance is still Populytics?
Yes.
Okay. And what brings you here today?
Just here for a checkup.
Okay. How have you been feeling? Any issues, sicknesses, injuries?
Nope.
Okay.
I've been feeling pretty good.
Excellent. Great. Do you have any medical conditions?
No.
Chronic illnesses?
No.
Injuries?
No.
Have you ever been hospitalized?
No.
Have you ever had surgery?
No.
No. Okay. Do you take any medications?
No.
Do you take vitamins?
I take vitamin B complex every day. I don't know the dosage of that though.
Okay. Do you take any herbal supplements?
No.
Do you have allergies to any medications?
I have allergies to sulfa. I get an itchy hives.
Okay. Any other allergies?
No.
Okay. So sulfa is your only medicine allergy?
Yes.
Okay. How about family history of abdominal illnesses or conditions? Any, your parents, grandparents, or siblings? Any history of colon cancer, kidney cancer, Crohn's disease, IBS, hemochromatosis, alcoholism, cirrhosis?
My mother's father died of colon cancer.
Okay. Any kidney disease in your family?
No.
No? Okay, great. Do you smoke?
No.
Do you use any tobacco products?
No.
Did you ever smoke?
No.
Do you drink alcohol?
I do occasionally. I'll have maybe a glass of wine with dinner, maybe once a week.
Okay. Do you use any illicit drugs?
No.
Did you ever use any like injectable drugs?
No.
Okay. How about immunizations? Have you been immunized for hepatitis?
Hepatitis B, yes.
Okay. And you're up to date with your vaccines?
Yes.
Okay. Do you follow a special diet?
I'm a vegetarian.
Okay. Do you exercise?
I do. Maybe 5 days a week I do jog.
Okay. Do you, what kind of work do you do?
I'm a nurse in an ICU.
Oh, excellent. Any exposures, bloodborne pathogens, or any toxic exposures at work?
No, I use standard precautions.
Excellent. Great. Okay. Just going to ask you some questions. You said you'd been feeling good. Any recent fevers, chills, fatigue?
No.
How about unplanned weight loss?
No.
Unexpected weight gain?
No.
Okay. Recent nausea or vomiting?
No.
Abdominal pain?
No.
No. Any indigestion, heartburn?
No.
Excessive bloating?
No.
Gas?
No.
Constipation?
No.
Diarrhea?
No.
How are your bowel habits?
I'm pretty regular, like four times a week.
Okay. Any blood in your stool?
No.
Any like black tarry stools?
No.
White, gray, or orange stools?
No.
No? Okay. Any difficulty or painful swallowing?
No.
And your appetite's pretty normal?
Yes.
Yeah? Okay. Have you ever had jaundice? Ever had yellow skin or anything?
No.
No. How about urination? Any painful urination?
No.
Blood in your urine?
No.
Foul smelling urine? Any like urinary urgency or hesitancy?
No.
Stress incontinence?
No.
No. How about flank pain? Flank pain?
No.
No. Okay. No kidney pain? Recent UTIs? Kidney infections? No.
No.
Okay. All right. We are going to start the assessment portion. I'll have you lie back, and I'm going to wash my hands and warm my stethoscope. Okay. Make sure you're in the shot here. So I'm going to start with inspection. Do you mind exposing? Excellent, thank you. I'm going to examine Sarah's abdomen and also her skin. I'm going to look for jaundice. Eyes glare are nice and white. No jaundice skin. Abdomen is equal. I don't notice any aortic pulsations or peristalsis. I don't see any masses, any lesions, stretch marks, spider angiomas, none of that. I also don't see any hernias, so no abnormal signs on inspection. Second part, I'm going to oscillate palpitate. I'm going to listen for your vowel sounds in 4 quadrants, and then I'm going to listen for bruits. So, this might be cold. Audible vowel sounds in 4 quadrants. I'm going to listen at the aorta, no bruit. Listen at the renal arteries, iliac, and I don't hear any bruits. Also going to listen at the liver. For a friction rub. I don't hear that. Okay. Next thing I'm going to do is percuss. This is some light tapping. So I'm going to percuss 4 quadrants of your abdomen. Then I'm going to percuss your liver to identify the margins, and the same thing with your spleen. Okay? So just some light tapping. Does this hurt? No. I'm going to identify the margins of your liver here. Identify where it becomes dull. The margins of the liver seem pretty appropriate. I can't hear the dullness that well. I'm going to percuss the spleen here. Again, I'm not identifying any abnormalities with the spleen percussion. I'm going to lightly palpate the 4 quadrants of your abdomen, just with my palmar surfaces of my fingers here. Any pain? And I'm not feeling any masses or abnormalities. So I'm going to do some deeper palpation. I'm going to press a little bit deeper. Any pain? And I don't feel any organs or masses or anything. Okay. So next I'm going to palpate your liver, your spleen, and then your both kidneys. So I'm going to palpate your liver. I'm going to use a hooking motion here. Try and palpate the margins of the liver, and Sarah's liver is not palpable on my exam. And reach over, pardon me. Same thing here with your spleen. Any pain here? And I'm not palpating the spleen at all. Okay. So are you able to turn to your left side? Pain with this? No. Okay. This right kidney is not palpable here. I'm going to check for some CVA tenderness. I'm going to do a little bit of a stronger percussion than I did on your belly, okay? Tell me if you feel pain or tenderness. No. Okay. Then you turn. If you turn on your other side, I'm going to try and palpate other kidney here, left kidney, and again, it's not palpable on my exam, and I'm going to do that same fist percussion. Any pain with that? No. Okay, you can lay back. Excellent. Okay, so I am going to just finish with some specialty tests. I'm going to start by doing a Murphy's sign to check for cholecystitis. So I'll have you inhale, and I'm going to press your right quadrant by your gallbladder. Any pain? No. Okay, you can exhale. And then we're going to do some tests for ascites. Now, I don't visualize any ascites on exam, but I'm going to do these tests. So the first thing, I'm going to palpate or percuss your liver again, identify the the areas of tympani and dullness, and I'm going to do it supine and then with you laying on your side, okay? And there, I can hear the dullness right there. Okay, then I'll have you roll over to your left side. I'm going to do the same thing. Okay, and those areas of tympani and dullness remain the same, so that's a negative finding for ascites. Are you able to press your hand right along your abdomen? I'm going to tap each flank and look for a fluid wave, okay? So, and there's no fluid wave. Okay, so the last 4 tests I'm going to do are going to be checking for appendicitis. So I'm going to start in your left quadrant here. I'll have you inhale, and I'm going to press down. Any tenderness, any deferred pain or rebound tenderness? No. Okay, and then I'm going to do the McBurney sign. I'm going to locate your interior iliac crest here, and about 2 centimeters towards the umbilicis. I'm going to press down. Can you inhale? Any tenderness?
No.
Okay. Now, again, I'm going to try to elicit a psoas. So I'm going to just have you, if you can lift your leg against my hand. Do you have any abdominal pain, lower abdominal pain? No. Okay. And the last, we're going to do an obturator sign. So I'm going to have you bend your knee, and I'm going to turn it inward a little bit, inward rotation, any sharp abdominal pain with that. Okay, great. Well, we're all done. Do you have any questions?
No.
Okay, thank you so much.
Thank you.
Bye.